In LGCW, my talk was about disparities in cancer. And I brought in a lot of examples from Southeast Asia. So the perspectives that I spoke about in the event was on disparities in cancer from Southeast Asia. Okay, the determinants are multiple. So what I divided it generally is based on the socio-demographic factors that people are familiar with, but also across systems related factors such as the health systems that are in place, and then the political environment, and also health financing mechanisms that are in place in countries, the country's income level, which are external factors. So these are some of the sources of or disparities, or we can even call it determinants of cancer disparities. The cancer disparities, the insights from Southeast Asia encompass, like what I just covered. So it starts from very basic socio-demographic characteristics, such as the instance with age. So while we would think that with increasing age, there would be more disparities because we would expect that those individuals who are older may have, disparities in terms of knowledge, in terms of the way that they can react when there is a stressor or burden of cancer. But some of the, I would say, interesting things that we found in Southeast Asia is even among the young people, for instance, cancer literacy was very poor. So this was something that was surprising for us. Then going on to gender-related differences. So there are definitely a lot of gender-related determinants that play a role in disparities in cancer. So we can start from the moment a woman is at risk, having risk factors and trying to engage in preventive behaviors. So there's a lot of barriers when it relates to women, also because of their roles in the society. And this just trickles down also when we are talking about opportunities for early detection, participation in screening. So there's a lot of gender-related disparities. And apart from that, one of another important determinant of cancer disparity in Asia is ethnicity. Southeast Asia is a multi-ethnic country. So we do see a lot of ethnic differences. And the ethnic differences can play in very different ways, just from prevention, early detection, the kind of management that they choose to have. So there is also a lot of disparities between different ethnic groups. And of course, when it goes down to also surviving cancer and surviving cancer in terms of living with the disease, but also in terms of survival, as in those, the mortality risks are different across different ethnic groups. These are just few examples. So, and then I think this I have to highlight. So often we think that socioeconomic status and the income of a country determines whether there's disparities, and we would naturally make assumptions that the low and middle income countries will have a lot of disparities. This is true, but it's also true that even in high income countries, there are going to be a lot of sources of disparities that go along the same line of age, sex, ethnicity, and so on. And a good example is the research that we have conducted in Singapore, where we have shown that there are a lot of ethnic differences. Even though Singapore is a high income country, we do see gender-related differences and ethnicity-related differences across the cancer continuum. So those are the things that I think, which was something that I highlighted in the event from Southeast Asia. So disparities, if we want to overcome the disparities, there are many levels that we need to think about. So I think the easiest way to look at it is from a socio-ecological perspective. So of course, there are the individual level factors that can be addressed. And we can also look at the society level, and then goes to the community level, and society and community, and also the wider systems level interventions. So sometimes the system level interventions are harder or seems harder, also because there are a lot of external factors, especially like political will and multi-sectoral collaboration that's required to adjust or to address some of the systemic or systems related disparities. But at the community level, there's a lot that can be done from mobilization of resources within the community. So this is where, for example, I think in this instance, when I was talking, I was alluding to financial well-being or financial toxicity. So not all of the solutions need to come from the systems level or from the government. It can come from the community, from the, like community participants such as the civil societies, professional societies, industries. And then, of course, at the individual level, there also needs to be some sort of empowerment. And this sort of empowerment can run across, like cancer literacy and at the family level, like creating better environment for gender equity and so on. So if we want to tackle cancer disparities, there are many, many levels and factors. Everyone can play a role. And it can be short-term, intermediate, and long-term. So countries have to sit and think with their stakeholders where to target and who can they involve in addressing some of these disparities that I was referring to. I think one of the things that I really believe in, and I thought that we should and we are not paying enough attention to, is again looking at interventions, right? So most of the time what happens is the low and middle income countries are asked or advised, or sometimes it may not be an external thing, but internally they tend to look at high income countries for solutions. But what I find lacking, or there's not enough airtime for discussion, is how low and middle income countries can learn from one another and sharing of best practices. So there are a lot of amazing interventions which are being carried in low and middle income countries. Some of them are published, some of them may not be published because they're not really in the literature. They may be in gray media. So I think what we need to do is, for the low and middle income countries, as well as the high income countries, to facilitate this sort of cross-country transfer of ideas and sharing of best practices. So this is something that I think we need to put resources in. And implementation science is definitely one of the main, I would say, tool to get this working. So I think we need to invest resources, be it in terms of training, in terms of money. These are the areas that I think are low-hanging fruits, in fact. So I use the word copy. So I think, why can't low and middle income countries copy from another setting, a low resource setting, where people have done well in a certain area? So I think this is one of the important thing that I would think is worth sharing with everyone.